Hello, good morning, friends. Meeting after a very long time. Have a happy Sunday and a nice day ahead. So, meeting you after a long time for a homeopathic discussion. Today, just a thought came in my mind that why not to share my experiences with the ICU patients and how to differentiate the remedies or how to apply it practically. And that's why I thought to make a video, discuss with you so that it will be little bit helpful for you in future. And that's why I'm here to share regarding the some of my knowledge for applying the Apis Mellifica, Apocyanum, and third remedy, that is the Digitalis, because I have used them in my practice and even in ICU. And the practical application, how I used to use my logic while applying those, that I want to share with you. So let us start with the subject. Let us go ahead with the subject. I will not going to share anything which is from the book or which it is already there in the every book of a materia medica. But how I used to think logically. So when I want to share regarding the Apis Mellifica, the first remedy which we'll going to discuss, Apis Mellifica, everyone knows that it is a honeybee remedy prepared from it and have a typical action on the at the cellular level, specifically producing a dropsy or an inflammation. So that dropsy or that edema basically happens at the mucous membrane level or at the level of a skin, has a typical future. It has a typical rosy red hue, and that one has to catch. If a edema is associated with that rosiness, that redness, a typical redness over there, it definitely helps to find it out a remedy. You have to catch that edema. You have to understand that, and then you have to think about it. So, any area where there is a cellulitis associated with this rosy hue and associated with one more thing, that is the thirstlessness, then definitely it is apis. Don't think any other remedy. But today I will going to share not about this cellulitis view or action of a apis in that level, but I want to share something regarding the apis. So there is one thing that there is no audio. I think it should be there. If it is not there, I will try again. Are you getting it or not getting it? Now, Vaibhav, are you getting it? Now, okay. So, are you getting it? Definitely. Vaibhav, are you getting it? Yes, okay. So basically, how to apply this remedy and what I think logically while considering this remedy specifically. So I want to discuss that aspect. So I was called to see a patient who was there, totally bedridden, who is who is responding very slowly, having a total puffiness of the face, edema all over the body, old, emaciated, it's totally fixed, rigid body. He is a case of a old Parkinsonism with lot of medications consumed. And he was totally stiff because of that Parkinsonism and medication thereafter. And he is nearly about 80, 81 years of age and totally fist puffed up, not able to open the eyes. And he had a fever last week treated with allopathic medication and fever subsided, but all of a sudden, since last 2 3 days, he had not have urine. Even after giving a Lasix, the urine output was zero, nearly about 5 to 10 cc only. And that patient, when I saw, they sent me a video. I observed that video, and I thought logically. I asked the patient's relative, who is a MD medicine. I asked her that how is the pulse volume? And pulse volume, it is what she said. All other parameters are very clear. Everything is good. Pulse volume is good. So when pulse volume is good, everything is good at a cardiac level, and still patient is in a condition of a oliguria or anuria. It is the separation of a urine because it is a renal dropsy, and patient is not able to consume anything. Whatever is put in the mouth, he throws it away. He never takes. He never swallows it, and there is no thirst. Patient has not consumed anything in last 2-3 days. So when I observed this condition typically, so only remedy in my mind was the Apis Mellifica, because there is a thirstlessness, because it is a renal dropsy, because it is the separation of a urine, because of earlier used antibiotics, earlier used antipyretics, and patient is going into the state of a renal failure. It is going towards the renal failure. So and when I observed that the breathing sound, it was very high pitched breathing sound was there, and it used to uh, produce a severe breathlessness, and he was responding very shrill. He never even asking him or giving him loud noise. He used to uh, react very slowly. In fact, it was only 1+ response was there, and total puffiness of the face, the edema wherever in which whatever position he used to lie down, the edema settles over there. So I prescribed Apis Mellifica 6 potency. And Apis Mellifica 6, when I have given, after prescribing Apis Mellifica 3 doses every 15 minutes, and I saw the patient after 2 hours, within 2 hours, the puffiness has gone. Nearly about 50% of the puffiness has disappeared. The patient has passed nearly 50 to 60 cc of urine after consuming that, and his breathing has he becomes less gradual. It becomes normal little bit, much normal. In fact, the sound which was very high pitched while taking that has disappeared. So when you think about the Apis mellifica in ICU, you must think that it should be a renal dropsy. It is not a cardiac dropsy. It is not a problem of a circulatory failure. Here it is the problem of a renal insufficiency, a renal what you can say at inflammation, parenchymatous inflammation of the kidneys, and getting blocked. Kidneys are getting blocked, and that is very typical of a Apis. That's what you have to find it out. That's what you have to look for. So when you consider Apis, always think that it should be renal, and second important thing, it should be associated with thirstlessness. Third important thing, if edema, if you are able to judge or if you are able to watch, that has a typical red pinkish hue. These are three important characteristics of the edema or a dropsy of the Apis mellifica. So this is what you have to look for Apis. The second remedy which is there is Apocynum, very close. After Apis, immediately Apocynum comes. But there is a difference between Apocynum and Apis. When I used to think about the Apocynum, it has both the things. It is not only the renal dropsy. And that's why we'll discuss Apocynum later. One remedy which is very important, one has to differentiate in ICU, is the digitalis first, and then we'll discuss about the Apocynum, because these are Apis and digitalis. These are two different parts, acts on two different parts. Digitalis, whenever I used to think, first I used to look towards the patient. I used to feel the pulse, and if pulse volume is very less, pulse is very feeble, it is very slow, and if you ask the patient from a recumbent position to make it him in a sitting posture by giving him a backrest. Immediately you find that pulse becomes immediately fast. It becomes dicrotic. In lying down, it is very slow. In whenever patient is in recumbent position, it becomes fast, dicrotic. But still, it is very, very, very feeble, scarcely perceptible. Indicates that the heart has not a capacity to press that blood, and that's why it is a cardiomyopathy. The word which is used very commonly, it is the myocardium which becomes very weak, very emaciated, and doesn't have a strain to force to contract, is the digitalis. In fact, it is cardiac dropsy. It is cardiac dropsy which is characteristic of a digitalis, and that's why when there is a, even though there is a dropsy, it doesn't have a renal significance. It is first cardiac. Because of cardiac, number of times it happens that there is renal insufficiency, less blood goes into the kidneys, and then secondarily kidneys can get affected. But first, it is definitely a cardiac dropsy which is there in digitalis. I have used it with my father. In fact, 1 years back, when he had the typical feature that he used to get intermittent pulse, his pulse becomes feeble, and he used to get breathless after walking for few footsteps. He used to breathless. He get breathlessness, and I used to check his pulse, and it intermits every third, fifth, seventh beat. And at that time, I thought about the digitalis. I have given him digitalis 30, and with digitalis 30, he settled so nicely that he never required the digitalis even after next day. And since last 1 year, he is maintaining that everything. It gives the strain to the musculature. Cardiac muscles gets very typically a strength after giving the digitalis. So this is what you have to look for. That in digitalis you get that dropsy. In digitalis you get that renal dropsy later on because of renal insufficiency. But first, definitely it is cardiac and cardiac dropsy only. So these are two important remedies. Apis is having action on kidneys first. In case of digitalis, it has very typically on the heart. So these are two different ends where you can find it out. Digitalis, I have given it in 30. I never used to use it in mother tincture. I give the digitalis in 30 potency, and it worked. Apis Mellifica, I used to start with 6 and then I used to raise it 30, but generally I starts with 6. Digitalis also you can give it in 6, but I don't have that at that time, and 30 his otherwise condition was good, and that's why I have selected the 30 digitalis. The third remedy which I want to share with you is the Apocynum. And Apocynum is having both the ends together. Apocyanum, even though very close to Apis, it looks very close. It has a cellular action on the cellular tissue, producing dropsy at the level of mucous membrane and skin. It looks very close to Apis. In books, it has been mentioned that it is mm, dropsy with thirst is Apocyanum, dropsy without thirst is Apis. But this is not only the thing which you have to look for. In fact, you must be very clear with your clinical understanding of the remedies, and if you are able to judge that, then you can think about the Apocynum. If you read the Apocynum thoroughly, you will find it out that Apocynum is having very clear cut action on the heart musculature also. In heart, there is a valvular problems. There is a mitral regurgitation, there might be aortic regurgitation, and associated with the dropsy, associated with renal dropsy. See, both the things are together. The renal dropsy is there, plus cardiac dropsy is there. There is a regurgitation, aortic as well as mitral regurgitation, and all those things associated with typical a thirst. Patient is thirsty. So you have to catch all those things when you observe. So what is needed at that time? needed is clinical examination. You feel the pulse. It is not like a digital is that absolutely feeble. The pulse is quite good, but still drops is there. Sometimes you must have a stetho and see the murmur. And murmur is associated with edema, associated with increased creatinine level, the puffiness of the face, and with the thirst. Then it becomes Apocynum. So clinically, you should be thorough enough to find it out or to judge the remedy. And this is what you have to look for. One more thing in which I have used Apocynum number of times is that some patients who used to suffer from the acute fevers like typhoid or scarlatina, some means a fever with a rash. Nowadays, these types of fevers are quite common in your practice. The fever comes, there is a rash, and patient get a puffiness. These patients generally who used to develop dropsy thereafter as a complication of treatment of those viral fevers, think of Apocynum at that time. Apocynum plays a very important role. Give the Apocynum. Generally, you can give Apocynum as a mother tincture over there. You can give 10 drops in a half a cup of water 3 times a day, or you can use it in potentized form in as a 6 or as a 30 in for the patient. So both things can be possible, but generally I used to use it Apocynum mother tincture, or sometimes I used to give it in 30. So it depends upon how the patient's condition is there. So this is very important that you must differentiate these dropsies. If you are able to differentiate, then you can think it logically. These are only 3 remedies I am discussing today, because there are a number of things which you have to consider while considering the remedies. But at least 3 we can differentiate, because these are 3 which are very important in dropsy. There is one more which you can think about is acetic acid also, where the dropsy is associated with the thirst. But acetic acid is having very typical of cancer miasm. And that's why acetic acid, it is a different remedy. We have to understand that in a different manner. So today I have just I want to discuss all those things regarding these 3 remedies. It is short thing, and one more thing that after a gap of a lot of days, I have considered. That's why I have not given any intimation to anyone that today I will going to share the thing. I used to share this video on Facebook also, and it will be available on YouTube also. But just for a try after a long time, it should be a good comeback, and that's why I thought that it's better to share something. And the thought came that yesterday only I have treated the case of Apis, and it worked beautifully. So that thought came in my mind. I have discussed it with all of you, and luckily enough, there are a number of people who are there. Vaibhav is there, Prithviraj is there, Rushikesh is there, Bhavin is there. Yes, all of you, thank you very much for watching it live. But it was not, it was for the prepare, it was for just a trial after coming back after long time. So thanks a lot for attending. And again, whenever time permits, I will share some clinical experiences with you, which will be beneficial for all of you. Thanks a lot for watching this video. And if you have any query, put a note at the end so that I will share my experiences. I will discuss with you. Thanks a lot for attending session. We'll meet again most probably whenever the time permits. Thanks a lot.